Thank you, Chairman Blumenthal and Ranking Member Grassley and members of the committee for this opportunity. I'm encouraged that the committee is pursuing a constructive conversation on this issue, and I'm grateful for the opportunity to share my work on the Women's Health Protection Act. I would also like to recognize the tireless advocacy of my Wisconsin State Representative, Chris Taylor, who is here today and will be on the second panel to share her experience working to defend women's access to health care in Wisconsin. I thank her for her testimony today. Americans across the country expect to have access to high-quality, dependable health care when they and their families need it. Indeed, my colleagues and I have worked to reform and improve health care, the entire healthcare system, to expand access to quality, affordable healthcare options so that all patients have healthcare that meets their needs. Unfortunately, for women in this country, this access comes under attack. Over the last 40 years, politicians across the country have been increasingly chipping away at the constitutional rights guaranteed under Roe v. Wade, which affirmed that women have the right to make their own personal health care decisions and have access to a safe and legal reproductive care. Since that landmark decision by our nation's highest court, too many states have been trying to turn back the clock on women's access to quality care. In just the past 3 years, states across this country have enacted a total of 205 provisions that restrict women's access to safe abortion services. This year, 13 states have been busy working to erode women's freedoms and have already adopted 21 new restrictions designed to limit access to abortion. In my home state of Wisconsin, we are now ranked as one of the worst states when it comes to women's reproductive rights, thanks to the restrictive measures enacted by our governor and our legislature. To name just one, last year our governor signed a measure forcing women who are already required by law to make 2 separate trips to the clinic to also undergo an invasive ultrasound 24 hours before receiving abortion care. This same law also forces healthcare professionals to have unnecessary admitting privileges at a local hospital. If it were not for a federal judge temporarily blocking this provision, 2 of Wisconsin's 4 abortion clinics would have been forced to shut their doors, and others would have been forced to reduce services, leaving many Wisconsin women out in the cold. But women and their families should not have to rely on last-minute court decisions to be able to make the best decisions for themselves and their families. I recently heard from a mother in Middleton, Wisconsin, who wasn't so lucky. When she found out that her baby had a severe fetal anomaly that would not survive delivery, she had to endure the consequences of the governor's new law before the federal court judge blocked the provision. She had to undergo an emergency termination, and a clinic in Milwaukee was the only place that would do the procedure. But because the governor was set to sign the law imposing these unreasonable requirements on providers, the clinic was preparing to close its doors and would not schedule her procedure. She and her husband were forced to find childcare for their 2 sons and travel out of state so she could receive the medical care that she needed. The threat in Wisconsin and in states across the country is clear. Some politicians are doing this because they think they know better than women and their doctors, and the fact is that they don't. Women are more than capable of making their own personal medical decisions without consulting their legislator. It is not the job of politicians to play doctor and to dictate how professionals practice medicine, nor is it our job to intrude in the private lives and important health decisions of American families. This is why I am proud to be a co-sponsor of the Women's Health Protection Act with my colleague, Senator Blumenthal and Congresswoman Chu, to put a stop to these relentless attacks on women's freedom. Let me conclude by briefly describing the bill. The Women's Health Protection Act would prohibit these laws that undermine and infringe on a woman's constitutional rights guaranteed under Roe v. Wade. Specifically, our bill would outlaw and mandate any mandate or regulation that does not significantly advance women's health or safety. Our legislation also protects women by invalidating measures that make abortion services more difficult to access and restrictions on the provision of abortion services that are not imposed on any other medical procedures. Congress is responsible for enforcing every American's fundamental rights guaranteed by our Constitution. Throughout history, when states have passed laws that make it harder or even impossible to exercise those rights, we have necessarily stepped in with federal protections. The Women's Health Protection Act would ensure that every woman, no matter where she lives, has access to safe, quality reproductive health care without interference from politicians. I thank you for your time.